Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Osteoporosis. Introduction. Osteoporosis means weak bones. It is a common condition that can lead to broken bones or fractures. Osteoporosis is common in older women, but it can be prevented and treated. This program will help you understand what osteoporosis is, as well as its symptoms, causes, diagnosis, and treatment options. Also included are tips for prevention. Osteoporosis. Bone is a living tissue. It is mostly made of collagen, a protein that provides a soft framework, and calcium phosphate, a mineral that hardens the framework. Our bones are continually replenished throughout life. The body deposits new bone and removes old bone. Until age 30, new bone forms faster than old bone is broken down. After age 30, bone is broken down faster than it is created. There are two main reasons why osteoporosis may occur. If a person does not have enough strong bone mass by age 30 before bone loss begins, if bone loss after age 30 happens too fast. Symptoms. People may not know that they have osteoporosis until their bones become so weak that a sudden strain, bump, or fall causes a hip fracture or a collapsed vertebra. A collapsed vertebra may cause severe back pain, spinal deformities, or severely stooped posture. Fractures can affect most bones of the body, but they mostly involve the hips, vertebrae, wrist, and arms. Fractures can be very painful and make it hard to do things. The bones can become so weak that a sneeze or a cough could result in a vertebral fracture. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Osteoporosis can begin at a young age if a person does not get enough calcium and vitamin D. After reaching maximum bone density and strength between the ages of 25 and 30, a person loses about 0.4% of bone strength each year. At this rate, and with good nutrition, people should experience this bone loss without developing osteoporosis. After menopause, women lose bone mass at a higher rate, as high as 3% a year. A woman reaches menopause when she has the last period of her lifetime. After menopause, a woman's body makes much less estrogen. Estrogen is a hormone, a substance that flows in the blood to control bodily functions. It helps to prevent osteoporosis. Risk factors. A person's gender is a risk factor. Being a woman gives you a higher risk of having osteoporosis. A risk factor is something that increases the chances that a person will have a disease. The other main risk factors for osteoporosis are age. The older you are, the more likely your chances of developing osteoporosis. Body size. The thinner your bone is, the more likely your chances of developing osteoporosis. Two risk factors of osteoporosis that you cannot control are 1. Race. White and Asian women are more likely to have osteoporosis than African American or Latino women. 2. Family. If your parents have osteoporosis, you are more likely to have it. Fortunately, there are risk factors that you can control. Calcium and vitamin D intake. If you do not get enough calcium, Ca, and vitamin D from your diet, you are more likely to have osteoporosis. Smoking. If you smoke, you are more likely to develop osteoporosis. Excess alcohol. If you drink excessively, you are more likely to develop osteoporosis. Inactivity. If you have an inactive lifestyle, you are more likely to have osteoporosis. Medicine. Some medications increase the risk of osteoporosis, such as taking steroids or antacids for a long time. Diagnosis. Medications are available to help people with osteoporosis. To diagnose osteoporosis, doctors use special tests to measure bone density. Common tests for bone density rely on X-rays or ultrasound waves. Regular X-rays show thinning bone. However, by the time X-rays can reveal osteoporosis, the bones are already too weak and osteoporosis is in an advanced stage. Treatment. A healthy diet, supplements, and medications are used to treat osteoporosis. Food that includes calcium and vitamin D include dairy products such as milk and cheese and oranges. Calcium supplements may help you get enough calcium. Discuss the risks and benefits of calcium supplements with your healthcare provider. Even though estrogen is very helpful in preventing osteoporosis, its use should be discussed with a gynecologist and should be monitored very closely. Hormone replacement therapy has several benefits, but may also have several serious side effects. Some medications have been shown to slow bone loss, increase bone density, and decrease the chances of future fractures. These medications may have side effects. Talk with your healthcare provider about the risks and benefits before starting any new medication. Prevention. People of all ages can prevent osteoporosis through healthy lifestyle habits, including a healthy, balanced diet rich in calcium and vitamin D. Staying active. Not smoking. Not drinking excessively. Exercise programs are encouraged but should be discussed with your doctor. Any sudden or excessive strain on your bones may lead to a fracture. As people become older and their bones weaken, preventing falls is essential to avoid accidents that can make it hard to move. People who develop osteoporosis should not lift, push, or pull heavy objects. They must be careful not to trip on thick carpet or throw rugs or to fall on slippery surfaces. People with osteoporosis should keep their homes well lit and should take their time going from place to place, especially at night. Using a walker or a cane in unfamiliar surroundings can be helpful. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Osteoporosis means weak bones. It is a common condition that can lead to broken bones or fractures. People may not know that they have osteoporosis until their bones become so weak that a sudden strain, bump, or fall causes a hip fracture or a collapsed vertebra. Some medications have been shown to slow bone loss, increase bone density, and decrease the chances of future fractures. These medications may have side effects. Talk with your healthcare provider about the risks and benefits before starting any new medication. People of all ages can prevent osteoporosis through healthy lifestyle habits, including a healthy, balanced diet rich in calcium and vitamin D, staying active, not smoking, not drinking excessively. The stronger the peak bone mass is during a person's lifetime, the less likely that person is to have osteoporosis. Thank you for using Explain.